much to say about pain.
Thank you, Samniji. I'm going to do my best to offer a brief review of pain from how it is that I, as a physician or physicians, think about it. Um, what I really want to emphasize is that pain is very much an individual experience, and every person is different, and what their body is, their medical conditions can really change how we think about pain. So I'm going to make general points, but it's really important to know that for every person it's different. And really talking to a physician or someone who knows your health history and knows your medical problems, all the medicines you're taking, is really, really important. I'm also going to try and keep this as short as I can. So if you guys have questions, please jump in, ask. I'm always happy to answer and discuss those kinds of things. Okay, so I'm going to get started. So I'll begin with what is pain? So, um, from my perspective, and I think how we think about it in medical training, pain is anything that you or a patient will tell us it is. It's defined by the person experiencing it. I cannot define someone's pain. It's anything unpleasant. It can be sensory, it can be emotional, but it's what people tell us, and it's complex because everyone's experience of pain is different, and how it affects them, their quality of life, how they function with that pain is different. And pain is not just physical, it involves psychological elements, it involves social elements, it involves behavioral elements. So it's important to keep all those things in mind. How do doctors assess pain? So if someone comes to me, how do I think about it? Well, I try to gather information. I try to find out where is the pain? How did it start? I try to find out qualities of the pain. Is it sharp? Is it aching? Is it constant? Does it come and go? Does it radiate or does it move anywhere? Does anything associated when I get pains? My vision is fuzzy. When I get pains, I feel tingling. When does it happen? Is it in the morning? Does it happen after I've been working for 4 or 5 hours? Is it better in cold? Is it better in hot weather? How severe is it? So all those things help me form an idea of where the pain is, the quality, and can really help me kind of form an initial idea of a diagnosis of what might be happening. Now, uh, in terms of thinking about pain and how the body anatomically sort of perceives pain, we kind of classify pain in two main categories. There's the nociceptive pain and neuropathic. So, and the way to think of this is that is this pain from a stimuli or is this pain because there's damage to the nervous system? Okay, so stimuli, nociceptive pain is if your body's reacting something. If I take a needle and I touch it sharply on my hand, that will stimulate the nerve fibers in my hand, and I will have a sharp sensation, and the nerves will transmit that pain in my hand all the way to my brain, and I will perceive that pain. If I have an infection, if I injure my hand, any of those kinds of pains, there's a stimuli, there's something causing that pain, and it's sending that pain to the brain. Now, that stimuli can be real, or sometimes it can be something that's irritated or kind of figmenting. But normally, there's some kind of stimuli. If it's in the stomach, if I'm very bloated, if I've eaten too much, the body will send a signal, Raj, you've eaten too much, maybe eat a little bit less, and so on. So that's the general type of pain we think about. Now, there's another type of pain that can happen if there's a damage to the nervous system. So, commonly, for example, in diabetes, if your sugars are very high, high sugars are bad for the health and they can cause damage to the nervous system. And when it causes damage to the nerves don't work properly and they start getting pain. They start getting burning pain, shooting pain, a lot of time in the legs. And that's not from a stimuli. It's not because something's touching their legs. It's because there's been some damage to the nerves from that disease. And that's known as neuropathic pain. And those pains can sometimes be similar, but the causes are different, and how we try to treat them can be different. All right, so I'm going to do a general review of pain. I was asked to talk about five main types of pain, which is dealing with headaches, neck pain, back pain, sciatica, and knee pain. So I will go into each of those a little bit, but I just want to talk about pain in general, how it occurs. So first is that a lot of times people get pain in their joints and they have pops and cracks, and they come to me and say, "Should I be worried?" And the answer is no. Pops and cracks and these kinds of noises that happen when we move our joints when we're standing or sitting or twisting, that's very common. We don't really understand why it happens, but it's not a serious sign. It's nothing dangerous. So if you're just having normal pops and things like that, I wouldn't worry. But if you're having it in pain, if your knee hurts and it hurts every time it pops, that's a problem, right? Then it's worth having that evaluated. How do I know if my pain is serious or not? Well, I woke up, I slept a little bit funny, and maybe my neck is hurting a little bit. Is that serious? Should I be worried? Should I see a doctor? Or maybe if I rest and I take some Tylenol, I'll get better on its own. How do I make that judgment? So common pain, and a lot of times this can happen as we get older, it's usually milder. It can be dull or it can be sharp. It usually starts slowly. It comes and goes. And if you have pain where like if I move my neck more and it hurts a little bit more and I rest, I get better, that's that's usually a safe kind of pain. And if I take a Tylenol or ibuprofen, my pain gets better. Those are common pain symptoms, and that's nothing that I think is serious to be worried about. The things that I worry about that are red flags that can be things for more dangerous is if you've had a fall or an injury that causes palm pain. If your pain is very severe and it doesn't get better no matter what you do. If you're having fevers or chills, or it suddenly comes on and suddenly goes away. Anything that's so painful that it wakes you up from sleep, something that's getting worse, or something associated with numbness. Like if suddenly you can't feel parts of your hands or your legs, you're having weakness, you can't hold things properly with a grip, or you feel like your knee is weak, those things are concerning. So those are red flags, we call them. If you have anything like that, especially if there's a fall injury, especially if you feel like it's very severe, if it's waking you up from night, or you have like feelings of weakness or nervous symptoms, those are concerns for more serious, and those are things I think it's worth seeing a physician to get evaluated for. Anyone have any questions so far? And you can type questions too. I'll be watching the chat. Okay.
So, uh, can you hear me?
Yes.
Yeah, one question I have is with respect to when I get to sleep, correct? The calf muscles start spinning for some time and then it goes away. So, what this pain will be? How
That's a
do
good question. So this is, sometimes when people are going to sleep, they may have some pain, and maybe it's in your calves, and then after some time it gets better. So I would say that I wouldn't classify that as a serious pain if it's just a calf pain. And if it gets better as you go to sleep, that's a good sign. Now, that doesn't mean it's not real. We should still treat it, and there's a lot of things that can cause leg pain and calf pain, and I'll come back to that. I would say for a lot of people, it depends if you're hydrating well, like if you are dehydrated, you don't have a lot of electrolytes, that can cause calf pain if you're not stretching your legs. Certainly can cause it. If you're walking a lot, of course, you're going to be more tired at the end of the day. And then if you have other chronic illnesses, that can also cause it. So what causes pain? We don't always know, but smoking is really bad. So I always tell everyone, please don't smoke. And there's genetics. If some people in your pain have certain types of pains, there's more chance that you can have it. Right. So I'm going to now go into these individual topics. We're going to start with headaches. So headaches is one of the most common types of complaints I see. And there's lots of different types of headaches and the way they're classified. What I'm going to talk about is the most common types of headaches. And so when people come to me with headache symptoms, there's usually a primary headache disorder, meaning it's a true headache, or sometimes that feels like a headache, but it can be something else, like sinus pain. So a lot of times people that have allergies and they have sinus symptoms, as that picture shows, you can get symptoms in the head and behind the eyes, and it can be very painful. But it's actually not a headache, it's a sinus issue, and you have to treat the allergies in the sinus, and that can get better. In terms of actual headaches, the usual type of headaches we tend to see the most are tension, migraine, and cluster headaches. And I'll talk about each one just a little bit. So migraine headaches, we think, oh, so I'll start with tension headaches, sorry. So tension headaches are the most common type of headache. They're mild. Usually you get a dull ache, a pressure. You can have it go from the top of the head all the way to the back of the head. And sometimes you can even feel it shooting down to your neck. So tension headaches can kind of be in any location. They tend to be more general, dull aching, usually kind of going to the back. Usually you don't have any vision changes with that. It's just you just feel that area there. Migraine is a little bit different. Classically, migraine symptoms have this visual element where a lot of people they get light sensitivity, where bright lights are painful, loud noises are painful, and many people have an aura where in their vision they start seeing rings or they have vision changes, and that kind of lets them know this headache's going to be coming on. Usually with migraines, it's not both sides; it's usually one side or the other. It's usually throbbing, and it can usually gradually come on over time. And then finally, rebound headaches. So these are headaches a lot of times that if you have tension headaches and you take a lot of caffeine or you use a lot of pain meds, sometimes you can get into these rebound symptoms where you drink a lot of caffeine, you have a lot of chai, you have a lot of things, and then you go a day without drinking anything or you have any caffeine, and you get a headache from that because your body's so used to having the caffeine. So like I see this a lot in a lot of people that have a lot of caffeine in their diet, and if they suddenly stop the caffeine, they can get headaches, and we call that rebound headaches. And usually after 2 or 3 days, if you say stop caffeine, it will get better on its own, but that can be very tricky as well. So those are the kind of general causes of headaches that I tend to see. Does anyone have any questions on that before I go to neck pain?
So, Dr. Raj, I have a question. So,
Yes.
the pain in the back of the head would be a tension one then, right? Like,
It's a good question. So we don't know for sure. These are just general guides. You can have pain in the back of the head. It could be tension. It could be something else. Headaches are one of the hardest things for me as a physician to evaluate because a lot of times I need a lot of details. I need people to keep diaries and see what's happening. But generally, a lot of times if you have headaches that come in the back of the head and you can take some Tylenol, ibuprofen, it gets better. I think that's reasonable. Another thing to keep in mind with headaches is how often they happen. If they happen once or twice a month, that's not concerning to me. But if they're happening once a week or more, that's a lot, and that can cause a lot of impairment, or it's just very inconvenient or unpleasant. So if it's happening more than once a week, I definitely try to look into a lot more and see what might be going on.
gotcha. And the notes to keep are those Socrates method that you initially mentioned, like what causes.
Yes.
Okay, thank you.
Hello, Dr. Raj.
Yes.
You mentioned when someone comes off caffeine, for example, they have chai and coffee. Let's say they reduce the coffee, and after a few days, it's fine. But you mentioned they can also have challenges. I was wondering about that.
Yes. So there are general class of certain types of drugs or things like caffeine in that class that if you're having a lot of caffeine and you're used to having caffeine every day, and that like from chai or other things, if you suddenly stop it, right, you're used to having 2 cups of chai every morning or one in the morning, one afternoon, you suddenly stop it. Not everyone, but many people might get headaches because their brain and their body is used to having the chai, and suddenly without that, they get a rebound of the headache. And when that happens, that can be quite painful and quite uncomfortable. Now, typically, rebound headaches after 2 or 3 days, your body gets used to not having the caffeine, and you can be okay. Or if you want to have caffeine, if you drink some chai or caffeine again, you'll drink the chai and you'll feel like your headache goes away because it's better. If you want to stop chai, if you want to come off of it and you have this problem with rebound symptoms, the best thing to do is do it gradually. So you want to, reduce from 2 cups to 1 cup, 1 cup to half a cup. And then if you need to know that you are going to have a rebound, so maybe take some Tylenol ibuprofen for 1 or 2 days after you stop the medicines, understanding rebounds are common. And usually by day 3 or 4, you don't have to worry about it and your body should have adjusted. So does that answer your question?
Yeah, no, I got that part, that after a few days it's fine. I thought you meant there's more deeper beyond that.
I
Maybe not.
yeah, yeah, there's a lot more nuance to it. Without I'm hesitant to go into too many details and take up too much time on it, but there is more to that. My general belief is that we're all better off not having caffeine in our diets. Certainly, I understand many of us it helps us get up in the morning, gives us some sense of energy, and that's fine, and it's safe. Um, a lot of it depends on how much you're having. So you can decide, you can see how much caffeine you're actually having in your diet. You can be measuring it. And if you have a cup of chai that's 50 mcgs or micrograms of caffeine, that's very different than having an energy drink which has 300 micrograms of caffeine, which is a much, much higher dose. So I think for many people, if you're having a cup of chai and you're having a lower dose of it, that puts you in a safer range. A lot of the rebound headaches I see tends to be people drinking very, very high amounts of caffeine. So great. Any other questions? Good. So I'm going to transition and talk a little bit about neck pain. So
Oh, I was on mute. I'm sorry.
go ahead.
I have a follow-up question. The question is caffeine also associated with concentration? Sometimes when you drink chai, you feel you have better concentration. Is that
That's
psychological or is there a
that's a
physiological association with it?
that's a great question. What I can tell you is that we've done things where we look at, say, students and their performance on exams. Like if you're studying for an exam, you're performing an exam, do people who drink caffeine have better test scores, better outcomes? Because that's a good measure. If it's actually objectively improving your ability to concentrate, I would expect to see a performance improvement. I would expect to see you do better on your tests and your exams, right? And when you look at all the data, drinking caffeine doesn't improve test scores at all, whether you do it for high school students, college students, any kind of learner. So for us as individuals, it may help us in the morning. It may help us feel like we're able to concentrate more. It may make our tasks a little bit energy. It gives a sense of boost. But in terms of performance, when you look at it, it's not actually like giving a massive boost how people are performing. How well you do an exam is you can't just drink a cup of coffee and it's going to magically make things better. You still have to do all the other things. Now, there are some medicines out there that genuinely does help improve concentration for individuals that have ADHD, attention hyperset deficit disorder. When we prescribe them specific medicines to help manage that, they take those medicines that does actually improve their concentration because they have a medical problem, and we do actually see improvements in their test scores. And so I feel pretty confident in saying that caffeine can help us feel like we're doing better, but there's no strong data saying that's going to improve performances.
Okay, thank you.
Yes. Great. Any other questions? I'm turning this from a pain conversation to a caffeine one. It's good.
Well,
Okay, what?
it's a very touchy
Yeah.
subject because
No,
everybody loves their
I,
chai,
I,
and
yeah. I
at
think
the
it's
same
good.
time, one of my medical doctor friends has said that chai is really bad for you. So it's a conundrum in itself.
I think I'll have to do another talk just talking about chai, it looks like, and caffeine. But yeah, it'll be a good one to go into depth into. So I'll come back to neck pain. Let's see here. So neck pain's a little bit trickier because when I think about neck pain, there's really two ways that are common causes of it. One is that you have your spine, your neck spine, or we call that cervical spine, and we worry about problems in there. But there's also a lot of muscles in the neck, right? Because your neck has a lot of mobility. You can tilt left and right, turn left and right, up and down. So in order to do all these different motions, have this great flexibility, and then really support your head, the neck is a lot of muscles, does a lot of important work, as you can see in this picture there. And so there's a lot of places you can get strains and you can have pain related to the muscles area. So when I think about neck pain, I'm trying to figure out, do I think this is something with the spine or do I think this is more of a muscle issue, right? Um, and when I think about muscle issues that can cause neck pains, a lot of times it does overlap with tension headaches. You can get myofascial pain. So you have, muscles that go from the upper back up through your neck into the back of your head, the occipital area. And that whole area there is a very common area for to have strain, to have tension headaches, to have fascial neck pain. Also to have strain. So, if I sleep the wrong way on the pillow, I can have strain, things of that nature. A whiplash injury. So people in car accidents where suddenly the neck quickly moves forward causes a lot of issues there in that area. And so those are things that we can manage safely, but a very common cause of it. More concerning the spine, some people can have fractures, and that can happen because of an injury, like a car accident trauma, or that can happen due to arthritis and compression over time. And then you can have disc-related pain and pinching on the discs. And that's more that's more of a spinal issue. That's more of a spine issue. And that's a little bit different. We have that. So when I'm looking at the spine, this is just anatomy of the spine. It can get very, very tricky because you have discs there, you have different joints, you have ligaments, you have nerves coming out. So it can be really hard. And if I think someone's having pain in their spine and not their neck, a lot of times we might have to do scans like MRI to kind of sort it out. But the big red flags to look out for here are if you have pain where you have shooting down to your arm, right? And you think it's your neck area, or if you have pain that's sudden, very severe, that's not getting better, a muscle pain, you feel stiffness. Sometimes you move the neck, it gets better or worse. Or if it's the spine, none of those seem to make a difference. That can be a lot more concerning. And so if we think there's anything related to the spine, important to see a doctor, important to have that evaluated to make sure there's nothing severe going on. Whereas the more muscle causes of pain, a lot of times we can manage with things like therapy, rest, anti-inflammatory meds, and time. Is neck pain common? Yes. 2/3 of people get it at some point, 10%. And a lot of this, especially in the muscle area, if stress, if you're reading, a lot of people in education, they don't have good posture. A lot of this is very, very preventable. So, questions on neck pain?
With increased cell phone usage, you see neck pain increasing because of the head is always.
Yeah, I see. You see that picture there. One of the pictures there is someone holding a cell phone to their neck. And those of you who are older, remember in the old days, you have these phones and you're trying to hold it with your neck and your head. Absolutely, posture is very important. I don't want to just blame cell phones. There's a lot of things that can cause bad posture in modern life, right? And I'm sure there'll be new inventions in the future that will make this worse. So, but yes, posture is important. And whatever devices, whatever you're doing, whatever is involved in your occupation day to day that has you doing repetition activities, and a poor posture can definitely contribute to neck pain.
Hello, I was curious about it being associated with higher education.
Yes. So it's association. It's not causal. So I don't want to say that people who are more highly educated have more neck pain. But there is this thing where when you look at the data, a lot of people who have neck pain are people who are in occupations that are higher education type occupations. So people think, oh, I'm a construction worker, or I work labor, I work outdoors, that those are the people that have neck pain. That's actually not the case. A lot of people who are sitting in front of a computer all day are the ones who are coming to me with neck pain, right? And so I think it really suggests that posture and things like that are important when you're considering this.
And that makes sense to me.
Any other questions? Good. So I'm going to discuss back and sciatica, and I put them together because they kind of they're different symptoms, but they tend to kind of be grouped because anatomically they're near each other. So back pain, probably one of the most common things, more than 2/3 of people. Fifth most common reason we see people have it, and it's really highest after the 30s through people in their 60s. So, a common age group. When we think about back pain, we think about when it's acute, meaning it's a short term, usually less than 6 weeks, and then chronic, which is more than 3 months. And they're very, very different causes for why you can have short term back pain that resolves versus this chronic back pain that can be very, very difficult to manage. And then, with back pain, there's a lot of causes with it. Stress, people who are physically working a lot, who are outdoors, manual labor work, you see a lot more back pain. Also, people who are very sedentary, not getting enough exercise, you'll see that a lot. A lot of psychological elements to this as well. And people who have anxiety and depression, a lot more issues with back pain as well. Very, very challenging problem. What are the causes of it? Similar to neck pain, you have muscle issues. You can have a sprain in the lower back muscles. You don't have as many muscles in the lower back as you do with the neck because the mobility is a little bit different, but it's very common that can happen. You know, if I'm at the gym and I'm not lifting weights carefully, I can pull a muscle there. But the bigger concern was really about is the spine, and there's a lot of the spine is a complex structure. There's a lot of different elements to the spine, and depending on where in the spine exactly you're having a problem, we have all kinds of different medical terms. So you can hear about disc bulges, you can have spine arthritis, you have spine stenosis. They're all technically a little bit different, but the general idea here is that there's a problem from the spine, and that is causing pain, and that pain is at the point where you have at the point of the problem. So if I have a fracture or if I have a stress or stenosis or arthritis at L3, L4, I will have a pain exactly in that spot, right? I'm going to have the pain in my back, generally where that injury is. Okay. Sciatica is different. Sciatica is not really even a diagnosis, it's more of a symptom. And what it is that there's this nerve that goes down the leg. And I'm gonna shoot forward here. Um, this is the nerve here. And what it does is that it basically helps control our leg for our leg movement, and it comes down from the lower aspect of the spine. And anything that pinches on those nerves will cause a shooting pain. And sometimes that pinching can occur when the nerves are coming out of the spine. Sometimes it can happen in the pelvis. Sometimes it can happen lower in the thigh area. So there's a lot of reasons you can get shooting pain here, but sciatica is more a pinching on this sciatic nerve that gives the nerves movement and control over the leg. Whereas back pain and spine pain is we're thinking more about the spine and the back directly itself. Okay, so when I think about low back pain, what are the most common causes? So the first is non-mechanical, meaning these are things where it's not the spine, right? If it's not the spine, it's a lot of times it's the muscles in the back. If we're lifting heavy things and we don't have good posture, if we fall on our back, if we have Paul sitting, we're bending forward, looking at our phones too much, or if we get arthritis, those are things that can all cause pain in the lower back. And those are all things that really should be managed non-surgically, a lot of ways that those are reversible and manageable. And so really, really causing, you can also have kidney stones, although it's a less common cause of back pain as well. Okay. And then you have like the more serious causes of back pain. So then when I worry about things like very severe arthritis, infections, cancer, things of that nature. And just like with neck pain, if you're having very severe symptoms that aren't getting better, definitely a red flag, definitely needs to have evaluated. I heard this term a lot. People ask, what is it? Does someone have a question? I get asked a lot. I get asked a lot about a herniated disc. What is a herniated disc? So this is a normal disc that we see in the top here. And a herniated disc is when that disc breaks, and herniated is just a Latin term for meaning pushing. So it pushes out and can cause pain because it starts pinching on the spine and the nerve. So it's out of place. What's interesting is that when we do imaging studies, like if I do an MRI or CT scan of the back, you will find a lot of people that have these mild herniated discs, but they don't actually cause symptoms. So it's not always a bad thing. Most people with these don't necessarily have symptoms, but sometimes they do, and it can cause problems and may need surgery. So, and then sciatica, what causes sciatica? So the main thing is that it's a symptom, and you can have usually a lot of different causes from it. Is either from the spine area, if something's pinching on the nerve, or it can be outside the spine if pinching is occurring in the pelvis or different areas down the leg and the thigh. And there are different muscles and syndromes that can kind of cause this. And a lot of sciatica can really do a lot better after therapy, stretching exercises, because once you strengthen the muscles, reduce any inflammation or things that are pinching on that nerve, it can really get better in a lot of patients. Okay. And so these are just common examples of different causes of sciatica. And that's it. Any questions on back pain or sciatica before I move on?
Can you cover more about osteoporosis?
Yes. So osteoporosis is a medical term, and what it basically means is that our bones are made strong because they have a lot of calcium and vitamin D that give it strength and help it stay mineralized and strong. But as people get older, the bones get weaker. And as they get weaker, rather than being very strong, they kind of lose a lot of their strength and they can actually start getting shorter, compressing, and reducing in size. So think of it almost as something that's a sponge that's very hard, and now you make it wet, and now you can squish it a little bit, right? And so when you have osteoporosis, because the bones are weaker, you're more likely to have fractures. So people can sometimes get hip fractures or arm fractures or things like that. Now, the spine is a very interesting joint. It's not like the elbow or the knee where it's moving and you're going to fracture a spot. The spine is like a column. And so when you have osteoporosis in the spine kind of shrinks. And as it does so, it can start causing a lot of these diseases where you have arthritis, stenosis, herniations because of that. And the main goal with people who have osteoporosis, especially women and older individuals, is to try and catch it and treat it before it gets severe and before you start having a lot of damage to your bones and you start having these symptoms. Great. Any other questions or any follow-ups?
So what's the treatment there?
Sorry, what was that?
What's the treatment for osteoporosis then?
Right. So there are medicines that we use to treat osteoporosis, usually a class called bisphosphonates to help make the bone stronger again. And that's usually what I prescribe to my patients, and I can convince them to take it.
Sorry, what medicine you prescribe?
There are many medicines. The most common ones are bisphosphonates, like fosamax, alendronate, things like that.
Got it.
Good.
May I ask a question, please?
Yes, of course.
I wanted to, since we're talking about pain, what about dental pain? You know,
Yes.
for example, it travels up the face and sometime into the eye.
Yeah, so
Would that,
very important. So that's a great point. So, I was talking earlier about headaches and neck
correct?
pain, but a lot of times pain can be referred from other parts of the body. So I mentioned sinus issues and sometimes people with allergies and sinus. That can cause symptoms that feel like headaches. So dental pain is another big problem because you can have dental infections, you can have cavities, you can have tooth-related pain, and rather than causing you pain in your teeth, it may cause you pain that shoots up to the back of the head, down below, and other areas. So very important to address if you have dental issues, and very important to treat. And that's one that is treatable and reversible. So that's an important one to identify. Absolutely.
So that pain, if it's traveling to your eye, is not the same as the cluster, because in your the illustration, the fourth one was a cluster and the eye was
Yes.
highlighted. It's
So I
it's
didn't.
not. It
That's
is.
it's a great question. So if you have dental pain, let's say, and causing you eye symptoms, how do I, as a doctor, know is that from the dental pain or could I be having a cluster headache? It can actually be very difficult to tease this apart. What I generally say is that if you have an obvious explanation for your pain, if you know you have a dental problem, I'll say let's treat that first and see if your symptoms get better. Because if you treat the dental issue and everything gets better, then I can say, okay, that was the dental pain. But if we treat the dental issue and you're still having symptoms that may be a cluster headache type symptom, then I feel like maybe we need to work that up next. So a lot of times you won't know the answer just based on an evaluation or an imaging scan. Sometimes you have to start doing treatments to kind of figure out what's happening. And it can take time. It may not just be one visit. It might take a while before you can figure these things out.
Okay.
Right?
Thank you very much for
Yes, of course.
my question.
Yeah. Any other questions?
Thank you, Dr. Raj,
Okay.
for your very inclusive and we can say very informative talk regarding different pains and their causes. And you have also suggested how we can be more careful about all these different pains and can come to know the real cause in our body for our various different pains. So thank you for coming and giving so informative, very lucid lecture.